Okay, this video is why is artificial intelligence, AI, for health a joke? It's obviously a joke. You just have to think about stuff. Everything always comes from top down. The big drug companies, they got billions of dollars. They're going to control artificial intelligence. It's obvious. They control everything in the health sector, okay? And what are they going to say? Drug companies are going to say, give more drugs. They're going to write all these algorithms, and the answer is always going to be, give more drugs. And not only are they going to say, give more drugs, they're going to say, give the latest drug, the latest and the greatest drug, because they can charge more money for it. If they give you the old generics, they can't charge as much money. Take a look at EpiPens. You know, the expiration date used to be, what, years and years? Now it's going down to 2 years, 1 year. Then you got to buy more. Drug company gets more money. They're always going to make the rules, and they're going to make the rules so they make more money. They've already getting rid of internal medicine doctors, family practice doctors. They're replacing them with nurse practitioners. Why? Because they can pay the nurse practitioner less money. America's going broke. And with all this, woke makes broke, okay? So with all this modern nonsense, the country's going broke. When I was young, America was so much richer. I lived in California, I went to college at Stanford. Okay, junior colleges were free. A lot of the state schools, people were wealthy. Doctors made 3-4 times what they make now. Okay, when I was growing up, almost all my friends, their parents were married and the mom stayed home, didn't work. It was a rare thing for a mom to work, okay? Divorce was also rare in those days. So anyways, America's becoming poor. When the country's becoming poor, the drug company still wants its money. So they're going to get their drug money, but the rest of the medical bill, they want to reduce it by paying the doctors less, get rid of the doctors, have nurse practitioners. Eventually, they're going to get rid of the nurse practitioners, replace them with PharmDs, and then eventually probably replace them with RNs, and eventually maybe replace them with a kiosk. The helpless patient will just come in, type a button, put their arm in a blood pressure machine, it'll dispense a drug. Okay, so, and the reason why it's a joke is because the drugs don't work. Almost all the diseases are due to diet and toxins, and you can't cure a dietary toxin-related disease with a pill. So it doesn't work. The cure rate for current drugs for hypertension is 0. The cure rate for diabetes with drugs is 0. The cure rate for atherosclerosis with drugs is 0. What's the cure rate for atherosclerosis with the Allicin diet? It's about 100%, okay? So why would you want an expensive, unpleasant treatment with side effects that has a 0 cure rate when you have a free one? You got to buy food anyways with a 100% cure rate. Only a stupid idiot would want the other option if they know both. Okay, so that's the scoop on what big drug is going to do with artificial intelligence, but it's worse than that. Big imaging. The companies that make all the CAT scanners, the MRI machines, the ultrasound, they're always going to recommend more screening, because screening is like, imagine the imaging company standing up at a shopping mall on the roofs of the buildings with a giant net, and they take that net and they throw it on all the chumps walking by. And they say, come to our screening test, we'll help you to diagnose this disease early. Okay, what the patients don't understand is, for every patient who you find an early cancer, and by the way, finding an early cancer doesn't necessarily do anything useful, because a lot of times there is no effective treatment. So if it's a turtle, it's not going to hurt them anyways, meaning it grows so slow it's irrelevant. And if it's a vulture, they don't have anything to treat that. And even if it's a rabbit, a lot of times there is no effective treatment that makes any difference. So the patient doesn't really gain anything. But the other key reality is, for every significant cancer they find that the patient might benefit, they're going to find hundreds of incidental omas. Incidental omas are basically false positives that need follow-up imaging, possibly unnecessary biopsies, give the patient a lot of anxiety and stress. They can't move on in their life to their next goal because they're worried they might have cancer, and they need to go for 2 or 3 or 4 years of follow-up before they find out whether it's cancer or not. There's going to be a lot of turtle-type cancers, meaning cancers that would have been irrelevant, that are overdiagnosed, and they're going to be treated with big aggressive surgeries and chemotherapies, and the patient's going to suffer from those things. Okay, so I've been involved in screening for over 30 years, and I can tell you I would never, ever go for any screening imaging test, because there's too many false positives. Those incidental omas, they're brutal, the workups for them. I would not want those. And the only way you can minimize your risk of cancer is be a low-fat vegan with no oil, eat whole foods, organic only. I've been studying this for over 30 years in great detail, and that's the best I can tell you. Okay, what about the big device companies? So the big imaging company is going to write the imaging screening protocols. The big drug company writes the drug protocols. The big device companies are going to write the surgical protocols. They want you implanting their surgical devices because they make a lot of money with that. But you can't cure a dietary disease with a surgical device. So again, surgeries have a lot of complications. You're turning more people into patients, more suffering, more complications, more medical management. The United States is like the highest expenditure in the world for healthcare expenditures, but we don't have a healthy population. In summary, about the only people who are going to have a good chance of being healthy are the 1% or so that go low-fat, vegan, whole food, no oil, organic only, no alcohol, all that stuff, no caffeine. And then the 99% of the typical dummies are all going to just keep on doing whatever the crowd does, which is what they each other do. They're going to eat the sad diet. They're going to eat and as far as nutrition is concerned, they're never going to recommend a low-fat, low-sodium vegan diet. They don't want you to be healthy. Nobody makes money off of healthy vegans. Okay, healthy vegans, low-fat vegans. We don't need the healthcare system hardly ever. So they don't want that. They want making money off you. I call the high-fat Mediterranean diet as the Antichrist because it promises health, but it doesn't deliver. It's bogus. It's a fake. That's why I joke about the high-fat phonies, because they do have a lot of knowledge and they do say a lot of good stuff, but they lure you down that path into your own disaster with all these olive oils and canola oils and all this other high-fat food, nuts and seeds, and turn you into a chump, and flax and soy. Anyways, I think AI is going to accelerate the destruction of health in this country, and it's also going to make people unemployed, of course, too. So anyways, that's AI. I would avoid it as best you can.